Chapter 24, Hematologic and Renal Emergencies. The hematologic system has to do with the blood. The blood represents its own organ system. It has specific functions. The blood will control bleeding by clotting. It delivers oxygen to the cells. It removes carbon dioxide from the cells, and its removal and delivery of other waste products to organs that filtrate and then remove them. Blood is made up of solid components, the red blood cells, the white blood cells, and the platelets, and it's all suspended and moves around in plasma, which is the watery part. Medications can sometimes affect components of blood, have effect on whether they clot easily or don't clot, such as aspirin can reduce the stickiness of platelets. So with blood clotting, aggregation of platelets is the body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins that are produced in the liver, and then it's released to the bloodstream. And once these clotting factors are activated, they form clots through what's called the clotting cascade, and it makes the platelets more sticky, so they'll stick together and form clots. Now, if somebody were on something that would thin their blood, it's not necessarily thinning it, it's causing the platelets not to be quite so sticky. So abnormal clotting of the blood is referred to as a coagulopathy, and it can be done with medications too. Like I said, aspirin keeps the platelets from sticking together. They also have medications that'll make them more sticky. So when somebody's bleeding to death, they can give them that and help the blood to clot. But coagulopathies can occur when the body forms clots too readily or the patient clots too slowly, and then they have a coagulopathy. Certain diseases make patients prone to poor clotting, like an advanced liver disease or hemophilia or something called von Willebrand disease. So you want to be able to identify patients that have coagulopathies, and you want to identify them fairly early on. Certain medications, medications in which the normal ability to form clots can worsen the patient's disease. And you want to know if you have problems with that. If somebody is bleeding, it's going to be more difficult to control their bleeding. Patients with prescribed blood thinners, patients are more prone to have life-threatening bleeding when injured. And so when they're on these medications, you need to be prepared and constantly be looking for that problem. Anemia is a lack of a normal amount of red blood cells. You can have acute anemia. Anything acute is sudden. So acute anemia is a result generally of a sudden loss of blood. A chronic anemia, chronic is anything that's long-term. Excessive menstrual periods over a long period of time can cause anemia. Slow bleed in their GI system, in their stomach, can cause chronic anemia. Diseases that affect bone marrow can cause chronic anemia. Sickle cell anemia, this is a genetic disease affecting the red blood cells. It's more prevalent in certain types of ethnicities, African Americans, Indian, or Middle Eastern descent. It's a defective shape of the red blood cells. So the red blood cells resemble a sickle shape, and the cells have a short lifespan that leads to anemia. Complications then of sickle cell disease. These abnormal shaped red blood cells, as they're going through the smaller capillaries, get clogged and backed up because they can't flow through easily. And it happens commonly in the spleen. So they may have abdominal pain if that's the area where the cells are getting stuck in. They call this a sickle pain crisis. It can happen in the leg too, but there's just different areas it could happen. Acute chest syndrome can happen when it's happening there. They could have priapism, which is an erection that won't go away. They can have a stroke. They can also be jaundiced from liver dysfunction. 1 in 12 African Americans has the sickle cell trait. It doesn't always lead to complications, and it is possible to lead a normal life with sickle cell trait. However, when they have a sickle cell crisis, they do have quite a bit of pain, so these folks tend to be on pain medications quite a bit, and some of them even develop addictions to pain medicine. What are you going to do for it? Well, administer oxygen, monitor for breathing problems, monitor for signs of shock, and transport to a stroke center if the stroke is suspected.
Sickle cell anemia is a genetically transmitted disorder marked by a severe reduction in circulating red blood cells. Red blood cells are produced in the red marrow of bones such as the vertebrae, ribs, and body of the sternum. Red blood cells are filled with hemoglobin that enables them to carry oxygen from the lungs to all of the body tissues. In sickle cell anemia, red blood cells contain an abnormal form of hemoglobin. As the red blood cell deoxygenates, the hemoglobin forms crosslinks with other hemoglobin molecules and long crystals develop. Crystals continue to form as oxygen is released and the red cells assume a sickle shape. Sickled red blood cells are inflexible and rigid and cause mechanical obstruction of small arterioles and capillaries, leading to pain and ischemia. Sickled cells are also more fragile than normal, leading to hemolysis. Tissue death secondary to ischemia progresses to organ failure with repeated occlusive episodes. Sickle cell anemia cannot be cured. Treatment is aimed at preventing sickle cell crisis, controlling the anemia, and relieving pain. Blood transfusions and fluid replacement expand blood volume and oxygen exchange needed for reperfusion of occluded vessels.
So now on to the renal system. The renal system has to do with the kidneys. We have 2 kidneys. We have 2 ureters that the urine goes through from the kidneys, and 1 urethra where the urine comes out. And the kidneys are responsible for filtering blood and removing the waste. This helps to maintain a fluid balance. This helps to regulate blood pressure, and it also maintains an acid-base balance or a normal pH in our bodies. There's several diseases that it can affect the renal system, and it can affect many different portions of it. This can range from minor to life-threatening problems. For instance, you could have a urinary tract infection. It's the most common disease that afflicts renal and urinary system. It's caused by bacteria. Usually, a urinary tract infection is just limited to the bladder area. It causes pain and frequent urination, and sometimes that urination is painful. If left untreated, it can result in something called pyelonephritis. It's basically a urinary tract infection that goes up the ureter and into the kidney. Whenever you see nephritis, it has to do, or nephrinate, it has to do with the kidney. So nephritis is a kidney infection because itis is an infection. Kidney stones are other problems, usually made with calcium, and it's formed within the kidney. While it's in the kidney, they don't cause any problems. But when they become dislodged, they can start to travel down the ureter, and this can cause a one-sided or unilateral flank plane, and it'll radiate down into the groin area. So they might have right-sided pain, and it radiates down into the groin. That would be a kidney stone. Could be on the left side. Patients may report nausea and vomiting with it. Patients sometimes have urinary catheters. That are put in, and they send them home as a result of renal obstruction of the bladder outflow, or they could have a neurological disorder that they have this for. Usually urinary catheters drain urine. They're commonly inserted into the urethra, and they can be placed through the skin also if they can't get them in through the urethra. Complications of urinary tract infections and local trauma at the site of the catheter insertion are some things that you could have run into on people that have urinary catheters. Renal failure. This occurs when kidneys lose the ability to adequately filter and remove toxins. Acute renal failure typically results from shock or a toxic ingestion. A chronic renal failure may be inherited or secondary to damage from an uncontrolled diabetes or hypertension. An end-stage renal disease is an irreversible renal failure. The kidneys just can't come back. People that have this usually are on dialysis. There's two types of dialysis. There's hemodialysis that happens through the blood, or there's peritoneal dialysis that actually happens through uh, an opening in the abdomen, a tube that gets placed into the abdomen, into the peritoneum, and it cycles and filters out through there. Most people have to go to special hemodialysis centers to get their hemodialysis, and they have to go 3 times a day generally. And if they miss, then they can become toxic, so almost. It changes their pH balance, and they have a lot of uh, of garbage, so to speak, waste product building up into their blood, so they can become septic. More than 400,000 Americans on dialysis who are treated in dialysis centers undergo 3 treatments a week, each lasting 3 or 4 hours. So only 8% are treated themselves at home. End-stage renal disease patients often rely on EMS for transport to and from dialysis. So you may transport at some point somebody that receives dialysis. Hemodialysis is a patient connected to a dialysis machine that pumps blood through a special membrane, and then these treatments last several hours, multiple times a week. Generally, hemodialysis is done through something called a shunt that's put in through, it's like a fake vein that's put into one or the other arm. And if you look at the picture, when they hook up to it, the blood filters through the tubing outside the body and into a filter, and then back in to the artery, and that's how it gets filtered. There's 2 types of access to blood circulation. They can access through a 2-port catheter, or they can have a fistula, which is that shunt I was talking about. It's called a fistula. AV fistula. Now, if somebody with an AV fistula will have something called a thrill, a characteristic thrill when you palpate it. It doesn't have a steady, regular heartbeat, so to say, but more of a, a constant flow type thrill. This guy here has a 2-port catheter. It's inserted just in his chest area, and it's put under the skin. It actually goes into a major vein in the torso, and they would hook up their dialysis machine to each side of those ports, and then it would filter through the machine. This is a picture of a fistula. It's placed under the skin. You can feel it, but you need to be aware people with fistulas cannot have a blood pressure taken on that side. So ask people before you take a blood pressure, which side is your fistula on? A lot of times they'll tell you, but if you see something like this in a patient that's unresponsive or they can't tell you otherwise, do not take a blood pressure in the arm that has the fistula. Peritoneal disease. Or peritoneal dialysis. This is where their dialysis is through a cavity, their peritoneum. And special fluid is infused into the abdominal cavity, and then it's left for several hours to absorb waste and excess fluid, and then they take that fluid back out and discard it. Peritoneal dialysis, a continuous ambulatory peritoneal dialysis, is the gravity exchange process repeats itself several times a day. There's also a continuous cycler-assisted peritoneal dialysis, and a machine is used to fill and empty the abdominal cavity while the person sleeps. And here's a picture of a peritoneal dialysis catheter. So medical emergencies for end-stage renal disease, there's two types, two broad groups. You can have loss of normal kidney function, or you can have a complication of dialysis treatments. Most dialysis patients have underlying medical problems, mainly diabetes and high blood pressure, most common. Usually it relates any problems with end-stage renal disease it's usually related to a patient missing dialysis, and then they have toxins building up in their blood. They'll have signs and symptoms of somebody that has congestive heart failure. So the shortness of breath, the edema or the swelling or fluid in their lungs and in their feet. They'll have electrolyte disturbances too. Their sodium and water will be shifting. What do you do for the end-stage renal disease patient who missed dialysis? Airway, breathing, circulation. Get your vital signs, but not on the arm that has the fistula. Give them oxygen and monitor those vital signs closely and get them to a facility that can do dialysis. You might have a patient that's bleeding from the AV fistula site, and so you want to do some direct pressure. Clotting and loss of function of the AV fistula can also happen. Bacterial infection of the blood due to the contamination of the fistula or the dialysis catheter site, or they could have peritonitis, an infection there. End-stage renal disease patient with complications of dialysis. If you have that patient, you need to take care of their ABCs, control any bleeding, use direct pressure, elevation, and even a hemostatic dressing if you need to. If bleeding can't be controlled by other means, you can put a tourniquet on and then give them oxygen. Treat them for shock, keep them lying down and warm, and if peritonitis is suspected, transport the dialysis fluid to confirm that. Kidney transplant patients. Kidneys are the most commonly transplanted organs. Approximately 16,000 transplants happen per year. Patients spend their lives then on a special class of drugs that'll help prevent organ rejection, and it'll also prevent they also have an increased susceptibilities to infections.
There are two types of renal or kidney failure, acute and chronic.
Acute renal failure is the sudden loss of kidney function that develops as a result of an injury or damage to the body in general, or the kidneys in particular.
Acute renal failure is caused by a blockage of urine flow out of the kidneys and into the bladder, exposure to certain drugs and/or toxic substances, or significant loss of blood, or a sudden drop in blood flow to the kidneys. Kidneys that have pre-existing disease or damage are at higher risk for acute renal failure.
Signs and symptoms include confusion, drowsiness, decreased urine output, small breathing, dyspnea, tachypnea, and coma. Acute renal failure is a very serious condition with a mortality rate in excess of 50%. Chronic renal failure develops over a much longer period of time as nephrons lose their ability to function and are replaced by scar tissue. Usually, this takes place over the course of many years.
In the early stages, there may be no symptoms, and progression may be so gradual that symptoms do not occur until kidney function is less than 1/10 of normal. Diabetes and hypertension are the two most common causes and account for approximately 2/3 of the cases of chronic renal failure. The goal of treatment for all renal failure is to identify and treat any reversible causes, as well as preventing excess accumulation of fluids and wastes, while allowing the kidneys to heal and gradually resume their normal function. In some cases, dialysis may be necessary. Dialysis is a method of removing toxic substances from the blood when the kidneys are unable to do so. Some patients may require a renal transplant to implant a healthy kidney into a patient with kidney disease or kidney failure.
So in review, the blood delivers oxygen to the cells and it removes carbon dioxide from the cells and it controls bleeding by clotting. It consists of red blood cells, white blood cells, and plasma. Anemia is a lack of red blood cells in the circulation. Sickle cell anemia is an inherited disease in which a defect in the hemoglobin results in a sickle shape to the red blood cells. This misshaping inhibits movement of red blood cells through the capillaries and it causes sludging or blockages in the smaller blood vessels, which leads to pain. The renal system is comprised of the kidneys, the ureters, the bladder, and the urethra. The kidneys perform vital filtering of the blood to remove waste products. They also help maintain water balance within the body. Problems with the renal system include infection, kidney stones, and renal failure. Renal failure is a condition in which the kidneys are unable to filter waste and provide a balance of fluids and electrolytes in the body. Dialysis removes excess fluid and electrolytes from the body by filtering it. Dialysis may be performed in either of two ways: hemodialysis or peritoneal dialysis. Hemodialysis at dialysis centers is generally performed 3 times per week. Peritoneal dialysis is done at home and is usually done several times daily. Major complications in patients with end-stage renal disease can occur after the patient has missed a dialysis appointment from infections or as a result of bleeding from hemodialysis access sites. Blood has specific cellular components. Abnormal blood cells can significantly affect patients. The renal system is critical to maintaining homeostasis, or that natural body balance. Renal failure can be chronic or acute. End-stage renal disease is managed through dialysis. So, questions that you would need to consider for somebody with kidney problems or sickle cell or disease or a hematologic problem, a blood problem. Does my patient have a history of sickle cell disease or end-stage renal disease? Does my patient have an AV fistula? Will I need to make an early request for ALS because of complications from a missed dialysis appointment? These people will be really sick. So you have a patient who's transported routinely for dialysis 3 times per week. She was sick and canceled a trip yesterday. Now she calls saying she can't breathe and feels like she's going to die. Is it possible that she has a legitimate complaint after missing dialysis by only 1 day? Yes, it is, because she's got toxic substances building up in her blood and she's got probably a shift in fluid. So you're going to see and maybe even hear fluid in the lungs or see fluid on the ankles and around the legs because it's a similar signs and symptoms of congestive heart failure.